Hello viewers, welcome to Talkshow. My name is Sylvia Rishinga and I'll be your host. Our guest today is MSU's Deputy Director of Health Services, Dr. Wilson Mpariwa. My first question is, statistics by United Nations show that girls aged between 15 to 24 are 2 to 14 times more likely to acquire AIDS than their peers. Why is that so?
Definitely, the statistics are showing that young girls and adolescent women are more at risk compared to the rest of the population. Mm-hmm. The main reason is their ability to be able to negotiate safe sex. Mm-hmm. There are a lot of challenges that make young girls unable to negotiate safe sex. One of the reasons is that they're dating older men. The fact that they're dating older men, it's more difficult for them to ask for contraception or ask for condom use from their older men, older partners. The other reason is frequency of transactional sex. There's a lot of transactional sex occurring in our society, especially with these young girls, where they get into a relationship with someone, maybe for data or for airtime, maybe requesting someone to do their hair and things like that. So whenever there's a transaction, it makes the girl unable to completely negotiate for safe sex. The other reasons that could also cause women to be more at risk is that a lot of them are young, their genital organs are not mature, and their genital organs not being mature makes them more at risk of contracting HIV compared to others. Then, of course, access to contraception and condoms. A lot of these young girls are unable to walk into a pharmacy or walk into a hospital to request these services, mainly because our society associates with a woman buying contraception with them being a commercial sex worker or things like that. So they're unable to open up and go and access these services from the public sector. So these are some of the reasons that cause our prevalence to be higher compared to other groups of the society.
And what can our adolescent girls do to prevent themselves and reduce their vulnerability?
Definitely, there's a lot of things that our adolescent girls can do to reduce vulnerability. And the main thing that needs to be done is providing access to information. Mm-hmm. When we provide information, we empower someone to make choices. Mm-hmm. Information can encourage our girls to abstain. Information can encourage our girls to be able to access condoms and contraception. Because if they don't have information, they don't know where to access it. In the times when you give someone information, they'll be able to access some of these services. And of course, discouraging transactional sex. Of course, it's now prevalent in our society, maybe at times due to economic factors, but we need to discourage it, providing information and support groups that can assist some of these young girls so that they can avoid getting into transactional relationships. And of course, at times, dating older people, yes, they may choose to date older people, but relationships with older people are more difficult to negotiate safe sex with. So we encourage some of them to avoid it. And we also encourage HIV testing. HIV testing is very important because if you test yourself and you test your partner, it helps you to be able to decide how to protect yourself or prevent yourself from getting HIV.
This is Campus Talk Show. As a director, what are you doing to help the students?
So the health services at MSU has done a lot in terms of trying to control HIV and contraception. We have tried to put initiatives that are peer-based, initiatives that look at students assisting each other, rather than us as the health services imposing things on students. We've encouraged students to come in, then we can assist them. So we've had assistance from a lot of development partners. We've had assistance from SAWAT. We've had assistance from Red Cross. We've also had assistance from Ministry of Health through the District Health Team. Mm-hmm. And we've also had assistance from National AIDS Council, Zimbabwe National Family Planning Council. These have come and provided us with services including condoms, including contraception, including training for students. Mm-hmm. Students to know what contraception is, to know what are condoms and how to use them properly and appropriately, to give them access to HIV testing services. So this we've managed to do, and we're now doing this talk show, this Campus Health Talk Show, is a way of giving information to our students so that they can be able and they may be aware that we are present and we are able to assist them. So that
Viewers, we are taking a short break and we'll be back with Dr. Mparia. Stay tuned. Due to the government-imposed COVID-19 restrictions, most people have been spending most of their time at home. How accessible have been the contraceptives to the youth during the government-imposed lockdown?
Thank you so much. During the lockdown, there's been a lot of challenges in terms of providing services for people, because people are unable to leave home, and there are restrictions and timetables that they're unable to leave home, or they need letters to be able to leave home. So we have done our part in terms of trying to disseminate information, because information is the key to people accessing services, at least if they access information. And through Say What has assisted us to have online WhatsApp groups where we've managed to engage students and talk about key issues that happen during lockdown. We've seen during lockdown an increase in unwanted pregnancies. We know that there could also be an increase in terms of risk of HIV. So we've tried to disseminate and talk about this information during lockdown through our WhatsApp groups. And this talk show that we're creating, we know it will assist a lot of our students during this time of lockdown. And we have partners that continue to support us in terms of providing contraception during lockdown. And these partners continue to assist, and they have structures across the country. National AIDS Council has got lots of structures. Ministry of Health, there's a lot of structures where our students can continue to access our condoms and contraception. So we continue to look out for them. It's a difficult period during lockdown, but we continue to look out for them so that we can assist them.
We have heard about HIV over and over again, and it's becoming a boring subject to the students, to the community. And why should we care about it?
Thank you so much. Government has created targets in terms of controlling HIV, targets of eliminating HIV and making it sure that it's not a public health concern over time. And we know that as MSU, we participate in achieving this target. So part of our role in achieving this target is to be able to eliminate HIV in our campuses. And as health services, we want to be able to reduce or eliminate HIV in our campuses. That is the reason why we have a drive to reduce HIV incidents in our campuses. There are a lot of services that have been initiated by government that we want to adopt, services like pre-exposure, prophylaxis, services like condoms and things like that. And these services, a lot of our students are not accessing them. We have a lot of partners that are coming through, but there's still a gap that needs to be filled in. And we tend to encourage other partners that want to assist us to come in and assist us so that we can be able to control our HIV challenges or issues within our society as Midlands State University. And our students, yes, they may be getting tired about it, but HIV is there, and we want to make sure that students that come into our campus that are on HIV treatment already are well controlled, and the HIV is well controlled. Those that come in and they don't know their status, we want to make sure they know their status. Those that that come out and they're negative, we want to make sure we prevent them from getting HIV during their stay on campus. So we have a big job to do, we have a role to do, and to achieve this, it's the participation of these students, and we also need partners that can assist us in terms of achieving this target. And if we do achieve this target, then we have assisted government in achieving the targets that we've put in making sure that they'll control HIV by 2030.
Thank you, viewers, for watching the show. Join us again next time.